Okay. So this is going to be our second visit with the same patient, same client that was here for the first visit of the diastasis treatment. The first visit that's on our website was about 3 weeks and 3 days ago. So for me, seeing patients, I see my patients once every 3 weeks. So this is a good sweet spot for visceral manipulation. Some of the other therapists here that take insurance, they see their patients once a week, and they're getting great results with that as well. But just for this client and this demo, it has been 3 weeks and 3 days to the date that she's coming back in for her second visit. So when she came in for her first visit, her numbers, just to refresh everybody's memory, above the umbilicus or the belly button was 3.5 finger widths and shallow. And then at the umbilicus or the belly button, again, 3.5 finger widths but shallow. And below the umbilicus, 3.5 finger widths but shallow as well. She's very consistent across the board. And then after the treatment that we did to the Jejunum Ileum, so the visceral manipulation to the Jejunum Ileum, where we ended is above the umbilicus, we had 2.5, no, two finger widths. So 2 finger width split and shallow. And then at the umbilicus was a 2 finger width split, and below the umbilicus was the 2.5. So 2, 2, 2.5. And that's where we ended about 3 weeks and 3 days ago. So I have not seen her, so now we're just checking to see what has happened. It could have reversed a little bit. I would be okay with that because it's not quite stable until we hit about 4 visits is what we're finding. Or it may have closed a little bit more. I'm okay with either one. So we're kind of see what's happening. And so again, my first measurement spot is 2 finger widths above the belly button. So again, my ring finger is at the superior aspect of the belly button or the umbilicus. Where my index finger comes is going to be my first measurement spot. Again, you can measure anywhere from the xiphoid process to the pubic bone. I just find, especially with women, it's usually around the umbilicus that is the biggest openings. So we're just going to be consistent with our measuring. So go ahead and raise your head up for me. A little bit more if you can. Awesome. And so what I'm finding, so here's her muscle belly right there. And then here's her muscle belly right here. And so I've got a 2, and it's a very, very shallow 2. You can probably tell I can't get in very far. And then go ahead and bring your head back down. So it's a very shallow 2. So it's pretty much stayed the same. The only thing I would say is the depth has closed in a little bit more. So it's even more shallow than it was the last time I saw her. Unfortunately, I don't have a measurement device for that. So this is the same as it was 3 weeks ago. So then we'll come down to the umbilicus. Okay. We'll put our fingers here. Go ahead and lift your head up. Awesome. Oh, interesting. Okay, so this guy, this has gotten better. All right. So I would give this a 1.5 finger width split here. Okay, so this is a 1.5, a roomy 1.5, but definitely a 1.5. So this finger here is having a hard time getting all of it in because this muscle belly goes to here. Okay, so 1.5. So this is kind of closed a little bit on her. So from a 2 to a 1.5. Okay, and so now we're going to come down to the last spot, which is right here. Now this is the one that went from a 3.5 to a 2.5. Again, if I remember right, she has a suprapubic scar down here, C-section scar. And I really think we have a little bit of the mesentery kind of trapped in that scar, which is why it just did not close as much at our last session. So we'll see. This could have opened back up a little bit. I wouldn't be surprised if it did. And so let's see. Go ahead and raise. Oh. Wow, you are a good healer. All right. Okay, so we're at 2 finger widths. Okay, so we're at 2 and a very, very shallow 2. Go ahead and come on back down. All right, so she's closed a little bit here and closed a little bit here since our last session. This one up here has remained the same. This is amazing. This is wonderful work. She's done a lot of core stabilization outside of here before she came to us. That probably had something to do with this, So she did not have anything open back up since our last session. So we're at a 2, a 1.5, and a 2. So we're going to do the same techniques as we did last time. I'm not going to use all my props because I've already done that on the first session. This time I'm just gonna treat her as is. Okay. So the first thing that we're going to do is we're going to treat the root of the jejunum ileum. So the root of the jejunum ileum. We're going to go from the DJ junction, so where the duodenum and the jejunum. Remember, the jejunum ileum is a small intestine. So right where they meet, we're going to go there. And then the other spot for the root is the ileocecal valve. The ileocecal valve is where the terminal ileum, the last part of the small intestine, kind of dumps into the cecum. There's a little valve there. So between DJ and the ileocecal valve is what we call the root. Okay, there's a superior aspect and an inferior aspect. They kind of run like this, above the belly button and below the belly button. There's just a thickened piece of parietal peritoneum. Just as a reminder, the parietal peritoneum is the balloon that most of our organs fit in, and 21 feet of the small intestine fits in it as well. So we're just going to test this root. It's very deep in the body. So I'm going to have her bend her knees for me. There we go. And then what I might have her do is I might have her do an anterior pelvic tilt or a posterior pelvic tilt, so we make sure she knows how to do that. Very good. And I might have her move her knees to the left very slowly and maybe to the right very slowly once we get in here to create a little bit more tension on the root. Remember that we work with visceral manipulation through the proprioceptive system or the mechanoreceptor, so we just try to create a little bit more tension in the system and then allow the body to heal itself. So here's DJ for her. I'm just going to go just a little bit above that with my thumbs and a little medial to that. So right there. Now the sides of my thumbs are going to sink in until I feel tension, which for her is about right there. And then I'm going to slide down inferior until I feel that I hit something like a speed bump, which is right there. So this is a superior aspect of her root. So I'm going to load that perpendicular to the root, and I'm going to scoop it anterior towards the ceiling and just say, how tight is that? And then I'll move one thumb over and then my other thumb, and I'll test another spot. I sink in, load perpendicular, scoop anterior, and I do it again. All the way over towards the ileocecal valve. As we get closer to the ileocecal valve, this gets looser for her. It's like not a big deal as we get over there. And so her tension really is between two spots here. So this spot and this spot. And I would say this spot is the tightest. So pretty much midline right above her belly button is where I'm at. Okay. I'm gonna leave my thumbs there. It's a placeholder. One finger from each hand is going to go just below the belly button. Again, not past DJ, meaning not lateral to that DJ line going inferior. So my fingers are here. I sink in until I feel a little bit of tension. And then I slide up. I hit the root right there. Okay, her whole body moves. That's how I know I'm on it. And then I load that perpendicular. I scoop anterior. I'm assessing how tight is that spot. I move towards the right on the root. So I move one finger over and another, and I can tell already this spot's a lot tighter than the first spot. And same thing. I move over, sink in, load perpendicular, scoop anterior. As I get over towards the ileocecal valve, it gets looser and looser. So then I come back to midline, just below the belly button, maybe a little bit to the right of the belly button. So they're pretty much right across from each other on the root of where I feel tension on both of these. So I'm going to go ahead and treat the superior aspect first, okay, just to kind of follow a protocol, even though this one down here, inferior, is tighter. And so make sure I'm right on that right there. So my thumbs are going to sink in, load perpendicular to the root, scoop anterior, and then I'm going to have her just bring your arm up just a little bit. Keep going. Keep going. Right there. Right there. That's where I felt tension under my thumbs. I told her to stop. And now my thumbs are kind of sliding towards the ileocecal valve and then towards DJ. That's what it feels like. It's really the root that's kind of sliding back and forth and releasing. But what it feels like is my thumbs moving from DJ to ileocecal valve. There we go. Good. And then go ahead and come on back down. Great. And we'll do it again. So we'll sink in with our thumbs. My fingers are just a placeholder. They're not really keeping depth. They're just reminding me of where my tension spot is on the inferior aspect of the root. So my thumbs sink in, load perpendicular, scoop anterior. Go ahead and bring that arm up. Keep going. Keep going. Right there. And here we go. The thumbs are moving back and forth. The root's kind of shearing back from DJ to ileocecal valve. Beautiful. And then come on back down. Very good. And we'll do one more. So we do about 3 on the superior aspect of the root. So I sink in, load perpendicular, scoop anterior, go ahead and go on up. Right there. And there's a tiny little release. Good. Come on back down. Now we could have used head movement, we could have used breathing, could use anything really to create a little tension. I'm just using her arm because I just know from the last time that that works very well for her. As I retest this spot, it's a lot looser than it was a second ago. Okay, so superior aspect of the root is a lot looser. I'm going to come down here to the restriction on the inferior aspect of the root. I'm going to get really specific here. It's right there. And one finger from each hand is going to sink in until I feel tension. I'm going to kind of slide up towards me until I feel the root, which is right there. Her whole body shakes when I get on it. I'm going to load that root perpendicular and scoop anterior. And then I'm going to ask her to do an anterior pelvic tilt. Other way. There you go. Beautiful. And then take your knees to the left just a little bit. Right there. Hang right there for me. And then that gets the root moving. So the root is kind of shearing over to Ileocecal Valve. And now it's shearing over towards DJ, so to her left. And now it's shearing to the right. And now it's shearing to the left. And now it's shearing to the right. And now it's shearing to the left. And then to the right. And right there it stopped. Go ahead and relax everything. There you go. And then we retest it. It's better than it was. Good. And we do it again. Sink in. Load perpendicular, scoop anterior. Go ahead and do that anterior pelvic tilt. Beautiful. Take the legs to the left. That seems to work. Keep going. Right there is where I feel tension under my fingers. I tell her to stop right there. The root is shearing to the right. I keep my load as perpendicular and scooping anterior. Now they're shearing to the left. And they're shearing to the right. And they're shearing to the left. Right, and then it stopped. Go ahead and come on back. Beautiful. And we come back in, we retest. Better, better, better. Maybe one more we're going to try. Sink in with my fingers. Slide up, there's the root. I load perpendicular, I scoop anterior. Go ahead and do an anterior pelvic tilt. Great. And then legs to the left. And right there's good. And here she goes to the right, and then to the left. And then to the right, and then it's done. Go ahead and come on back. Good. So now we have the restricted spot on the superior aspect of the root and the restricted spot on the inferior. So my thumbs are on the superior one. My fingers are on the inferior one. We're going to sink our thumbs and fingers down towards the table till we feel tension. We're going to go load perpendicular. So my thumbs and fingers are going to kind of come towards each other. And then we're going to scoop towards the ceiling, almost like we're picking the root up with our thumbs and fingers. The release always feels like your fingers go one way and your thumbs go the other way. I don't really have an explanation for why that happens, but that's always the release, and it's quick. It's kind of like a little finisher, like, okay, what did I miss? Okay, so that's the root. So then we're going to go ahead and treat loop the loops. So the loops of the small intestine, are there loops that are still kind of stuck together? So I'm going to put my right hand here. I'm going to put my left hand here, take up as much real estate as possible. Okay, so the small intestine is large. Okay, so you want to take up as much space as you possibly can. What I'm looking for is with motility. Motility is like a Asian fan kind of opening up to the left and towards the ceiling, and then closing down and to the right and towards the table. What I'm looking for is there an area where there's no movement? That's going to be where two loops are kind of stuck together. So here we go. And then my hands are super light. It's about 5 nickels pressure. If you put 5 nickels on her abdomen, that's about the pressure I'm giving here. It's very, very, very light. And I'll say I feel a lot of movement down here in my right hand. I'm right-handed, so I'm just going to move that right hand over a little bit. It's just a little easier for me to feel. And then this left hand feels okay up there, so now I'm kind of assessing each finger. Do I feel something moving through it? Pinky I do, middle I do, index, thumb, there's something kind of right in here. So between my middle and ring finger is what I'm assessing. Literally right there. There's no movement. Go ahead and bend your knees for me for a second. Okay, so with this one, I'm interested if this is really close to her scar. Pretty darn close to it. It's pretty much right on it. It's a little bit superior to the scar, but barely. So this is not surprising me. That loop and the mesentery and everything's probably got caught up in her scar here a little bit. I'm going to have 2 fingers right on that restricted loop, okay? And then those fingers are going to sink down towards the table until I feel tension. And then as I slowly take the pressure off, the loop is going to get pulled over to the other loop it's upset with, or restricted to. So here we go. I'm going to slowly come off. And it gets pulled up and over to me. So right here's the loop it's upset with. So I put 2 fingers from my other hand there, and I literally sink both hands down towards the table until I feel tension. I drift off a little bit, and here we go. So my right hand is doing counterclockwise motion while my left hand is doing clockwise. That's her loop doing that. My pressure is only to the table. And then right there, they just switched. So my right hand is doing clockwise while my left hand is doing counterclockwise. My pressure is only to the table. All the clockwise motion is her loops. And then they just switched again. And there they stop. Now they didn't move away from each other, so I don't think they're done. But we'll take pressure off. We'll keep our original fingers on that original loop. We'll give it a little break, meaning there's no pressure on it right now. And then we'll sink in, put pressure on it, drift off, and see, do I still get pulled to the same loop, or is there another loop where there's a restriction? Nope, same loop. So I come back on, 2 fingers from my other hand. I sink back in until I feel tension, which is right there on both of them. And then I drift off just a little bit. Okay, now this is different. My left hand is shearing down to her right hip, while my right hand is shearing up to like her left side a little bit. And then my right hand is now shearing down towards her pubic bone, while my left hand is shearing up to her left shoulder. That's good. That's like a separation. And that's her loops doing that. My pressure is only to the table. So they're still separating. So my right hand is going down to like her right pubic bone, while my left hand is going up towards her left shoulder. Big separation, and there it's done. I have a feeling it's finished, but we'll give the loop a little bit of a break, and then we retest it. So we put a little pressure on it, and then we drift off. Perfect. It's just literally popping straight up towards the ceiling, which tells me it's done. Okay, we've given it enough information to do a nice little release with that loop beside it. And then I put my hand back down for motility. Remember that fan opening and closing. Is there movement through there or not? And there is, and that's all I care about, is that there's movement, which I can feel. So that's loop to loop. So we've done the root, we've done the superior aspect and the inferior aspect of the root. We've done 2 loops together that were kind of restricted together. Now we do the mesentery. Remember, the mesentery is like a big sling that kind of extends off of the root and then wraps around all the loops of the small intestine and comes back. Your mesenteric arteries and veins kind of go through the mesentery that we're going to treat to the loops to feed them. So it's all the blood supply and everything. So we're going to get on the restriction of the root first to treat this mesentery. So I'm going to retest it. I'm pretty sure it's the same spot that we just treated. I'm going to have her keep her knees bent for me for this so that I can sink in a little bit easier. It's literally right there. Okay, as I keep going out, it just gets looser. Okay, so I'm going to keep 1 finger, okay, just 1 finger on the restriction spot on her inferior aspect of the root. I'm going to relax these fingers though, but they're not doing anything. Just my middle finger's doing something. And then I'm going to follow the line out, or the tension out, until it falls off. So I'm literally looking at the mesentery, kind of that apron kind of having like almost like a knot in it. And so if I bring my fingers here, I don't feel like I'm connected, but right there I feel very connected to my left hand, and there I'm not connected. So I come back, there's the connection, and I'm gonna walk down, still connected. You can actually see the tension line. For some people you can, and some people you can't, so don't always rely on that. And if I go past her scar, I fall off of it. And if I come back, literally right on the inferior aspect of her scar, so right below it is where this loop is at, okay? So now my fingers from my right hand are on a loop. My middle finger for my left hand is on the restriction of the inferior aspect of the root. So I've got root here, I've got loop down here. I'm working between my hands on this mesentery, or this sling, okay? So my root hand is just, my finger is going to sink in, load perpendicular to the root, scoop anterior. My loop hand is going to sink towards the table and then drift off just a little bit, enough to allow that loop to move. And here's what's happening. The loop is doing a counterclockwise motion, and the root is kind of shearing towards the left. And now she switched. So now the loop is doing a clockwise rotation, and now the root is shearing towards the right. Right there, she just stopped. And so I'm going to relax, but I'm going to keep my space, my placement here. I give her a little bit of a break, and then we'll do it again. What I'm looking for is I'm looking for my hands to move away from each other, like almost like if there was a knot in an apron here, and the knot kind of went and was untied, and so there would be a lengthening. Okay, so that's what we're looking for. And so we do it again. So the inferior aspect of the root, that restriction, we sink in, we load perpendicular, we scoop anterior. Our right finger pad, there's only one finger kind of doing this work. You can do one or two, it's up to you, depending on your fingers. I sink down towards the table, I drift off, and here we go. So the loop is doing a very, very strong counterclockwise rotation. The root is just kind of hanging there. It's not really doing anything. The loop seems to be doing all the movement right now. The loop just went back to clockwise, and then I got a tiny little shear to the right on the root hand. Okay, a little separation happened there. That's good. And then it stopped. So give it a little break. We'll do like one more. Usually after 3, it's enough. So again, we work through the proprioceptive system. There's like a little neurological loop that happens here. And after 3 times, you're pretty much not going to get any response from the body. So here we go again. So my left hand sinks in, loads perpendicular, scoops anterior on that root. My right hand sinks in towards the table, drifts off just a little bit on the loop. And here we go. Root is going to the left. The loop is going straight to the right. So this is like a shear. My pressure is only to the table for the loop. Okay, now this is good. The loop just kind of did a counterclockwise rotation toward and kind of went down towards her right pubic bone. So there's a little separation that literally just happened. And then I felt some gurgling, so that's usually a good sign as well. And right, it's almost done. It's just opening up is what's happening. My hands are moving away from each other. And right there, she stopped. Okay, so that was good. All right, so let's see. That was good. All right, so again, she has the scar down here, and so we'll see what happens. I still feel like there's still a restriction in this mesentery with her scar. Okay, again, this is only her 2nd visit, and so it takes about 4 visits for this to stabilize. I'm not going to be upset if nothing comes in a little bit more. If it does, fabulous. If it doesn't, that's okay, because as you saw a minute ago, some of these kind of closed over the last 3 weeks, which is great and wonderful. Okay, so we're going to come back up. We're going to test this superior spot. So again, my right ring finger is in the belly button. My right index finger, that's my spot that I'm going to measure. Now, again, this spot has went from 3.5 to 2, and then when she came in, it was still at a 2. Okay, so is it less than a 2 or not? I don't know. We'll see. So go ahead and raise your head up for me. It's still a 2. Okay, it's still a 2, and it's shallow, and I'm okay with that. Go ahead and bring your head back down. So, because again, this work, when we do it in the treatment rooms, it can take up to about 3 weeks for those changes to happen. And so here we go. We're in the belly button for this one. Now this one went from a 3.5 to a 2 to like a kind of roomy 1.5, if I remember right. Okay, for this one. So she was a roomy 1.5 when we started. Go ahead and come back up. Okay. Awesome. Okay, guys, so just so you know, I'm not making this up. So here's her muscle belly right here. And here's her muscle belly right here, like the lateral border or the medial border of this muscle belly, medial border of that muscle belly. So she's at a roomy 1. I could not, right there's the belly. If I tried to put that in there, there's the belly right there. So she's at a roomy 1 for that. So that's good. So she went from a 1.5 to a 1 with this. So that's awesome. Now for the inferior one, this is my spot right here. And then go ahead and lift your head up for me. Oh, fabulous. Okay, so guys, this is, I don't even know if I want to give her a 1 on this one. Let me be nice. I'm going to give her a 1. It's a roomy 1, and it's very, very, very shallow. Okay, very shallow, roomy 1. So go ahead and put your head back down. So I'm really happy with this. So she came in at a 3.5 on the first visit for this upper section here. It went to a 2.0 shallow, and it's still at a 2.0, and I'm okay with that. At the umbilicus, she came at a 3.5 before our first visit, and that went to a 2.0 in the first visit, and she came in with a 1.5 today, which is fabulous. So that closed up a little bit since our last session, and then after this treatment, it's went down to like a roomy 1. Okay, so 1.5 to 1. And then this one here came in at a 3.5 before our first session. After our first session, it went to a 2.0 or 2.5. And then when she came in, it was a 2, right? It was a 2. And then just a second ago, it was a roomy 1, which is awesome. This was the one I thought we would be struggling with a little bit. So we'll see. We'll see what happens with this. This is her second visit. And so we're going to have 2 more visits in this series to see if we can close this up a little bit more, especially this one up here a little bit. And what I'm hoping for is a 0 and a 0 down here. And then there's always an opening at the umbilicus or the belly button. So right now at a 1, she really doesn't have an opening here. So at a 1. So we're pretty happy with that. But if we can close this one up more and this one more, we'll be pretty happy with that. So another 3 weeks and we'll have another session.